Hello, my name is Grant Searchfield, and welcome to our first Tinnitus Tunes webinar. Today I'll be talking about tinnitus solutions for different tinnitus problems. Different strokes for different folks. Tinnitus has existed since mankind's earliest medical texts. Our understanding of tinnitus has, of course, increased over this period of time as we've begun to understand how the ear and brain works. I believe that tinnitus was generated within the inner ear itself, this spiral-shaped part of the ear connected to the hearing nerve. It was thought that the sound created activity in the auditory nerve, much like that created by normal sound. However, we now understand that it's more complex than that. Attempts to cure tinnitus by cutting the auditory nerve, if you like, turning off the tap of activity travelling up the auditory pathway to the brain, has largely proved unsuccessful. Cutting the auditory nerve removes hearing, but in many people with tinnitus did not take away the tinnitus at all. In fact, for many people, the tinnitus remained or potentially would become worse. By cutting off the supply of information to the brain, also one mechanism for helping tinnitus through use of sound was removed. That at one of the earliest processing stations of the brain, the cochlear nucleus, activity is increased following damage to the inner ear or hearing nerve. These photos show activity recorded from the cochlear nucleus in a normal hearing case and in a case where there has been noise damage. Each of these little spikes represents an action potential within the recorded neuron. Here we can see an increase in activity, and it's been postulated that this increase in activity is due to a change occurring at the inner ear that this particular processing station compensates for, creating more activity within the auditory pathways. And that this increase in activity might be tinnitus. It's gone on to also show, through brain imaging studies, that those individuals who can turn off and on their tinnitus have extra activity within their auditory cortex when their tinnitus is present. That's shown here by these grey areas, and in this bottom picture by the orange and red areas. So, we know that when a person experiences tinnitus, part of the brain associated with hearing, the auditory cortex, is also active. But this does not explain the whole picture, because now that the auditory system interacts with many other parts of the brain as a network. And tinnitus perception and the annoyance that tinnitus creates is a combination of activity from many different centers of the brain, including those involved in hearing, those areas associated with memory, areas of the brain that are associated with distress, areas of the brain involved in perception, and even areas of the brain associated with perception of somatosensory events. The somatosensory system is the movement and touch system. When that is active, such as when a person moves their arm or neck, this area of the brain becomes active. Research in tinnitus began to indicate that a person who experiences tinnitus has increased activity or connections between these different parts of the brain, and all of these parts contribute to the overall experience of tinnitus. That we sought to explain this and the effect of a person's environment on tinnitus is through a model which we call the ecological model of tinnitus. And the center of this model is the tinnitus sound and its interaction with sounds in our background, the background noise that we experience in most of our day-to-day activities, and who we are as a person, our personality, our memories, how we think about things, and our detection and prediction of what we expect in a sound. Also associated with tinnitus perception is our environment. Are we busy at work, or are we quiet, relaxing at home? Are we enjoying a social interaction, or are we exercising? Have we taken stimulants such as caffeine or other foods that might possibly have an effect for some people? Or is it the time of day that may affect tinnitus? Many of these things will not affect an individual, but for some people, they may be susceptible to change when they change their environment or undertake a different activity. Beyond that, we have another ring. These are social factors. These are big picture items, such as our beliefs, our understandings, our customs, our relationships, and our values. If we don't perceive that tinnitus is a problem, that is in fact a blessing, then tinnitus will not be a problem. For most of us, that's not the case. We find tinnitus annoying. And it is our belief that this is something that potentially can cause a greater problem. So we need to understand all of these elements and how they contribute to tinnitus perception. We can also interact with these different elements through sound, counselling, and potentially in the future, effective drug treatments for tinnitus. Now, there are some things that you with tinnitus can undertake that will put you on a path towards tinnitus not being a problem. Education, understanding tinnitus is very important. You may have fears and concerns about your tinnitus and your hearing, and understanding the truth about these things may relieve many of your fears and anxieties. In doing so, the tinnitus may no longer take on quite the importance that it does at the moment. We strongly recommend you seek medical help. It may be that there is something simple that can be done to help reduce your tinnitus. And certainly you should have a hearing test, because hearing loss is often associated with tinnitus, and hearing aids are a very effective mechanism for treating tinnitus. We strongly recommend you visit a physician or an audiologist to seek help with your tinnitus. It's also important that you have access to information that you can share with family and friends. They may not understand what you're experiencing, and it is very useful for them to do so that they can provide the support that is necessary for any recovery from bothersome tinnitus. Sound therapy, the use of sound to try and treat tinnitus, can be very effective. along with counseling, providing information and tools to help relaxation, sleep, and lifestyle can be very important. And these elements are aspects that I'm going to concentrate on in today's talk. It's also important to have ongoing control so that you can manage your tinnitus long term. These things that we hope to provide through our Tinnitus Tunes website as an aid to both yourself with tinnitus and also to assist clinicians in their treatment strategies is something that we will focus on today. The treatment approach offered by Tinnitus Tunes is holistic. We recommend assessment of your hearing and tinnitus by a qualified clinician to identify any particular problems that you may have with your hearing system or any medical contributions that may be making your tinnitus worse. On our website, we provide information how to improve sleep, recommendations on lifestyle, and also tips on how to refocus attention away from tinnitus. In today's talk, I'm going to be focusing on sound therapy and the use of sounds as an aid to that tinnitus refocusing. Next, I'm going to be mainly focusing on perceptual elements of the model that I introduced before. That is, the relationship between tinnitus, background sound, and what we call residuals, or who we are as an individual. We can simplify this diagram triangle, such as this here. In many circumstances, when we're bothered by tinnitus, it takes on an importance that is greater to other sound. This is determined in part by who you are as a person and what is happening in your environment at a particular time. That is, the focus that we place on tinnitus will be determined by what the sound is in the background, but also what we are thinking about. Look at a number of things that we can change to reduce the volume of tinnitus. On the Tinnitus Tunes website, for convenience, we break these down into 4 different elements: control, relaxation, attention, and adaptation. Let's start out by looking at control. One way of providing immediate control over tinnitus is by making the tinnitus less clear. And we can do that through the use of masking sound. By taking a sound and interfering with the tinnitus, we can replace the annoyance of the tinnitus sound with a sound that is more pleasant and one which you can control. Hearing aids are a very effective mechanism for doing this because it improves hearing at the same time. Other sounds that can be downloaded from the Tinnitus Tunes website can also assist. The goal here is not to create another sound that you are annoyed by, rather reducing the clarity of the tinnitus, how obvious it is, by placing another sound that is more pleasant over top of it to interfere with it. An example of how this can work is shown here in an illusion, the visual Ebbinghaus illusion. In this diagram, you can see 2 orange circles surrounded by a number of grey circles. The orange circles are actually the same size, but when you first look at these, you should think that the orange circle on the left of the screen is smaller. This illusion is created by a factor known as adaptation level. That is, what we perceive is based on our previous experience and memories of what should occur. When we place a small circle surrounded by larger circles, we perceive that small circle as being smaller than when we look at that circle in the context of other smaller circles. That is, if we hear tinnitus embedded within other sounds, it will not seem quite as apparent as when it is heard in silence. We can trick the brain using visual illusions, and we can train the brain using sound therapy to try and reduce the apparent magnitude of tinnitus. The result of a study undertaken using hearing aids for masking. The red line represents a change in tinnitus over a period of time with no masking. What you can see is that the red line actually shows no change. When hearing aids were fitted, but they did not interfere with the tinnitus at all, they did not improve the quality of life of the person with tinnitus. When the hearing aids were fitted, and they made the tinnitus a little more difficult to hear, what we call partial masking, represented by the dashed line, what we found is that the tinnitus had less effect on the quality of life of the person experiencing it. And what we found is when hearing aids were fitted, but the person could not hear their tinnitus with the hearing aids on, they showed the most dramatic improvement long-term in their tinnitus quality of life. So masking, this sense of control, can contribute to long-term changes in how tinnitus affects your life. We can achieve masking through hearing aids, as was used in this example, hearing aids in combination with background sound, or listening to sound through headphones. Whichever way is most easy for you and enables you to get the greatest benefit will be the best solution. However, if you do have a hearing loss, we strongly recommend considering hearing aids. Sound can help tinnitus is through relaxation. Now, in the case of relaxing sounds, we're not necessarily trying to directly cover the tinnitus or compete with it. Instead, what we're trying to do is to use the sound to influence our state of anxiety or emotion so that the connection between you as a person and the tinnitus sound is reduced while we interact with the pleasant sounds created by the relaxation strategy. Know, for example, that unpleasant sounds can make tinnitus worse. In this study that we undertook, when people with tinnitus were exposed to very brief sounds that were not pleasant, such as people crying or screaming, their tinnitus increased. When they were exposed to pleasant sounds, such as a baby laughing, their tinnitus decreased. The sound exposure wasn't long enough to have a masking effect on the tinnitus, but instead the emotional context of the sound and how it affected the person affected the tinnitus. Now, this is important ramifications for the use of sounds also for masking and for some of the other activities that we're going to talk about shortly. Because some sounds will be more annoying and other sounds will be less annoying. Now, in this particular diagram, we go from a quiet sound through to a louder sound. The red line represents the annoyance of the tinnitus, and it's most annoying and quiet. As we increase the level of a particular sound, what we find is the annoyance of the tinnitus decreases. However, as we increase the level of the sound, the annoyance of that sound increases. So it is possible to reduce tinnitus annoyance, but have a sound instead present that is just as annoying or more annoying than the tinnitus. So what we need to do is to have a sound that reduces the annoyance of the tinnitus, but when we play that sound, it has little annoyance itself. And this will differ for you compared to another person. So tailor making sound for you that is effective in reducing the tinnitus annoyance, but is not annoying itself, is very important. People enjoy water sounds. The lapping of waves against the lake shore, rolling surf, rain, or nature sounds like wind in the trees can be very effective in reducing tinnitus and also may not be annoying. The sounds can have surprising effects. Here are some different sound waveforms. We have 9 shown here. In this case, these are simulated sounds of ocean waves against the shoreline. In the top case, the surf sound rolls in and becomes louder before declining. And then the next wave comes in and it gets louder and louder and then becomes quieter. In this case, we have a similar surf sound, but they're more frequent. And in this case, the waves are very frequent. Down here, we've got a different shape of waveform. It has the same timing characteristics as the one at the top, but what we see is that it increases rapidly, but then becomes quieter slowly. Increases rapidly, and then becomes quiet slowly. Interestingly, when we undertook a study investigating what people preferred, while there was a lot of individual variation, this sound was the least preferred. Sound was the most preferred. What's strange here is that in most characteristics, the sounds are the same. They have similar pitch content. They have similar timing. However, in the case of the most preferred sound, it sounds as if the waves are rolling away from you. That is, they begin louder and then become quieter. Psychoacoustic research has indicated that for most people, sounds that sound like they are moving away from you gather less attention and are less annoying than sounds that appear that they're becoming closer. So even in this simple aspect, selection of sounds for tinnitus therapy can be quite tricky. Inevitably, there are going to be sounds that some people like for tinnitus reduction that you do not like. That is why in tinnitus tunes, we have a large sound library of sounds that you can listen to and select from. Tinnitus Tunes works on a subscription basis. This means you are not charged for each sound that you download, and you can visit the website as many times as you like and download as many sounds as you like during your subscription. This gives you a lot of flexibility in choosing the sound that is best for you. Example of two different sounds in a diagram similar to what I showed before. We have a surf sound and a broadband noise. Sometimes this broadband noise is referred to as white noise. What we can see is that with both sounds, as we increase the level of sound, the annoyance of the tinnitus decreases. But what can also occur is the annoyance of the sound increases. Notice that for the people in this study, the annoyance of the surf sound decreased at a slower rate than that of the noise. That is, people could achieve a higher reduction in tinnitus annoyance with less noise annoyance than what could be achieved with the broadband noise. However, in saying that, the white noise, the broadband noise, can potentially achieve the greatest reduction in how tinnitus is perceived. The only way we know at the moment for people to choose the most effective sound is to try these and to see which they can tolerate and which they find most effective for them as a person to use. Now, another aspect of tinnitus that we can modify using sound is attention. Often, a person with tinnitus will focus very much on their tinnitus. They seem to be able to hear it no matter the level of sound present in their background. It dominates their focus. They go looking for it. And in a quiet environment, it is very difficult to ignore. So when people are told you just need to ignore the tinnitus, you can become quite angry because it is very difficult to do. And it is not simply a matter of willpower. Instead, what can be done to help is the introduction of interesting sounds. This might be normal speech sounds through a hearing aid. Or it may be sounds from nature, incorporating interesting things to listen to. The way our brain works, we are only able to focus on certain sounds before we have to refocus on others. We cannot focus on all sounds at the same time. By introducing new, interesting sounds, we can help the brain move its focus away from tinnitus onto sounds that we are playing. Some of the sounds that we use for this purpose on Tinnitus Tunes, for example, are recordings in the countryside where there may be different birds, wind in the trees, even insects flying around. We use a special recording technique that enables the creation of virtual 3D audio for this purpose. That is, you sound like you are present in the environment. You are sitting in the countryside and all these sounds are happening around you. By listening out to other sounds, trying to identify what they are, where they are, the brain can focus on that listening activity rather than focusing in on the tinnitus. Also, we have some brain training available on tinnitus tunes. This brain training is based on some research that we've undertaken at the University of Auckland using recorded sounds to try and enable a person to focus their attention away from tinnitus and become better at hearing other sounds. In studies that we've undertaken, we've shown improvement in tinnitus, and lately we've undertaken studies investigating sound sensitivity that have shown that using this training can improve the tolerance of background sound. It's as if the brain becomes better at focusing on sounds that are important rather than the tinnitus. The results of some of that training. The training requires a person to use the training for about 30 minutes per day for anywhere between 15 days and 3 weeks. In this case, the study shows differences in a particular measurement of tinnitus before and after training. For these individuals here, we show the amount of sound that it's required to cover their tinnitus before, in the white bars, and in black, after the training. Now, for some people, the training did not affect the tinnitus. It did not improve it. And on tinnitus tunes, we are very clear to say that none of the treatments that we provide will work for everyone, and that we do not offer a cure for tinnitus, just a means to manage it. Although these people did not show improvement, these others showed a significant improvement in their ability to listen to other sounds that covered their tinnitus rather than the tinnitus itself. It took less sound in the background to interfere with the tinnitus than it did before training. Like all the treatment solutions on tinnitus tunes, we're continuing to do further research, and as we find out information, we'll keep you updated. Now, ultimately, it would be great if the tinnitus could go away. Now, while at the moment there are no cures for tinnitus in terms of any drugs or surgery, for many people, their tinnitus can decline to the extent that it is no longer a problem, and in the majority of cases, that it becomes something that is there just in the background that they are unaware of for the majority of time. We call this a process of adaptation. This adaptation is created through changes not only in the tinnitus itself, but in the way we think and analyze and process the tinnitus. The goal of tinnitus adaptation, through using sounds that interfere with tinnitus but decline over time, is to reduce the tinnitus so that it is no longer something significant in our lives. Interesting, in the research that we have undertaken using hearing aids and other sounds, is we often see what may be two different effects. One effect we often see immediately, fairly soon after we use sound therapy. And we believe that this is a masking effect. The presence of sound effect reduces the magnitude of tinnitus, much like the Ebbinghaus illusion that I showed earlier. However, over time, we see a process that leads to more and more reduction in the effect of tinnitus on quality of life. We term these adaptation effects. They take longer and probably involve aspects of the way that we think, interpret, and pay attention to tinnitus. So we may have an immediate effect due to masking and a long-term effect due to adaptation. Some sounds may be better for one than the other effect, but we expect that all sounds over time, as long as they are pleasant, can lead to a significant reduction in tinnitus. But it is very important that you select a sound that you are comfortable with and can use over a long period of time. When we undertook a study looking at the effect of broadband noise, the hissing sound, and a nature sound, mostly running water or surf sounds, we found two different patterns of effect. Both types of sound reduced tinnitus after 6 months of use to a similar degree. However, there's a suggestion that there may be two mechanisms in effect. One, a gradual reduction of tinnitus over time, which was achieved with the nature type sounds, and the other that seems to be more of a step, where the sound had a fairly quick effect, but then stabilized. We suggest that this might be a masking effect, changing the perceived magnitude of tinnitus, while this may be an adaptation effect due to changes in the way that we think about the tinnitus and its interaction with this pleasant, relaxing sound. More work needs to be undertaken to determine the exact mechanisms of effect. Now, the sounds that I've talked about can be accessed from tinnitus tunes and downloaded as MP3 files. If you have Bluetooth-enabled hearing aids, you can then stream them directly to your hearing aids. If you have an MP3 player or smartphone, you can load those sounds onto your player and use headphones. There is no wrong or right way of using sound, but we do suggest that you do not try and drown out the tinnitus by increasing the level over time. Instead, use a comfortable level of sound, and instead use that lower level to drag the tinnitus down, rather than to try and compete with the tinnitus too much. If you use too loud a level of sound, that will just create annoyance and have you focusing on your ears and consequently tinnitus more. So resist the temptation to turn up the sound. Instead, play it at a comfortable level. On the Tinnitus Tunes website, in addition to sound therapy, relaxing sounds, and brain training, you'll find information on good sleep habits, how to manage work stress, and how to be active and set goals for yourself that don't involve the tinnitus. A number of mechanisms are needed to change tinnitus, and you need to take responsibility for making that change happen. If you're a clinician, many of the tools on Tinnitus Tunes can be used to augment your current practice and provide excellent service to those individuals who are seeing you with their tinnitus complaints. We're learning, and we want to make Tinnitus Tunes a safe place on the internet where people can come and access evidence-informed treatments. So we'd like to hear from you. We'd like to learn from you. If you have tinnitus and have your own experiences with sounds that we provide, or information you think will help others, please let us know. And we would love to work with the clinicians out there to help identify how our services can make your clinic practice better than it currently is. Thank you for your time. It's greatly appreciated. Tinnitus Tunes is a spin-out company of Auckland Uni Services, the commercialisation arm of the University of Auckland. Some of the research that I've discussed in this talk has been supported by Brain Research New Zealand, the Centre for Brain Research, the University of Auckland, and this website is also the clinical website of the University of Auckland Clinics. So if you are a clinician and wondering how we use it, please let us know, and we can provide evidence from our clinicians as how it can augment and support your current strategies. I'm also very grateful to the groups that have supported and funded some of the research that we undertake at the University of Auckland, including the American Tinnitus Association, Auckland Medical Research Foundation, and the Tinnitus Research Initiative. These groups continue to strive to provide evidence for tinnitus-related therapies. Tinnitus Tunes is committed to providing safe, evidence-based research for tinnitus treatment. As we find out more about tinnitus, we will augment our therapies, and we will also let you know the latest in developments. Thank you for your time. In future webinars, we'll look at different aspects of tinnitus, and we hope to hear from you and your journey of tinnitus discovery. Thank you very much.